Understanding your stroke brain imaging results. When someone shows signs of a stroke, quick and accurate diagnosis is crucial. Brain imaging helps doctors see what's happening inside the brain and guides treatment decisions. The two main imaging techniques used are computed tomography and magnetic resonance imaging. Each has unique strengths and helps provide a complete picture of the stroke. A computed tomography scan is often the first test done in an emergency. It is fast, widely available, and excellent at detecting bleeding in the brain. Bleeding or hemorrhagic stroke needs to be ruled out before giving certain treatments. On a CORT scan, blood appears bright or hyperdense, making it easy to spot. Early signs of ischemic stroke, which is caused by a blockage, can be subtle on CORT. These signs include darker areas called hypoattenuation that indicate brain tissue damage from lack of blood flow. These changes can sometimes be seen within 3 to 6 hours after symptoms start. If no early changes are visible, it does not mean there is no stroke, but it suggests the damage might be less severe. CORT scans can also include angiography, called CORT angiography, which visualizes blood vessels to find blockages or narrowing that cause the stroke. Additionally, CORT perfusion imaging can assess blood flow in the brain, helping identify areas that might still be saved with treatment. Magnetic resonance imaging offers more detailed information, especially with a special sequence called diffusion-weighted imaging. This technique can detect early ischemic changes within minutes to an hour after symptoms begin, often making it more sensitive than CORT. MRI can precisely locate the stroke and distinguish between recent and older damage. It also provides detailed views of blood flow and tissue health, which helps in understanding how severe the stroke is and planning recovery. However, MRI takes longer to perform, is less available in some emergency settings, and cannot be used in all patients, especially those with certain metal implants. Interpreting the results depends on what the imaging shows. If a CORT scan reveals hypoattenuation in a specific brain area, like the middle cerebral artery territory, it indicates an ischemic stroke with cell injury. The presence of such changes usually means a more severe stroke and a higher chance of complications. If the CORT shows no early signs, it does not rule out stroke, and further testing or clinical evaluation is necessary. If blood appears bright on CORT, it suggests bleeding, which must be addressed before giving clot-busting medications. Vessel blockages seen on CORT angiography can help decide if procedures like clot removal are needed. MRI findings can confirm the diagnosis, especially in smaller or posterior strokes that might be missed on CORT, and help guide treatment and rehabilitation planning. The results from brain imaging are vital for deciding the best treatment. For example, if a clot is blocking a large vessel, doctors might consider clot-busting drugs or mechanical removal. Imaging also helps predict how well a person might recover by showing the size and location of the damage. Follow-up scans can monitor progress or detect complications like bleeding after treatment. Always remember to discuss your imaging results with your healthcare team. Your neurologist or stroke specialist can explain what the findings mean for your specific situation. Interpreting scans requires expertise, often involving specialists called neuroradiologists. Keep in mind that imaging is just one part of diagnosing and managing stroke. Your symptoms, medical history, and other tests are equally important in creating a complete picture. In summary, brain imaging helps doctors understand whether a stroke is caused by bleeding or a clot, how severe it is, and what treatment options are best. CORT scans are quick and great for ruling out bleeding and spotting early ischemic signs, while MRI provides more detailed and sensitive information about brain injury. Together, these tools help improve outcomes by guiding timely and appropriate care. Always seek personalized advice from your healthcare professionals to understand your specific results and treatment plan.